All right, today we're going to tackle one of the most stigmatized and frankly misunderstood conditions in mental health, borderline personality disorder, or BPD. So let's just push all those stereotypes and bits of misinformation aside. In the next few minutes, we're going to get to the real heart of what BPD is and what it isn't.
Okay, to really get a feel for BPD, I want you to imagine something for a second. You're on a tiny little boat, out on a really turbulent sea, and every single conversation, every little shift in someone's tone of voice, it isn't just a ripple, it's a massive wave that feels like it could just capsize you at any moment. That constant, overwhelming feeling of instability, that's the core of the BPD experience.
So here's the official, clinical definition. But honestly, if you're going to remember just one word from all of this, make it instability. It's not a character flaw or a choice. It's this profound, persistent struggle to find stable ground in relationships, in your own self-image, and in your emotions.
Okay, so where's the first place this instability really shows up? Well, let's start with what you could call the relational tightrope, that intense and often chaotic world of how someone with BPD connects with other people. So this gets at a core idea in BPD called splitting. Imagine your best friend forgets to text you back. For a lot of us, that's annoying, right? But for someone with BPD, that small thing could trigger a total switch. That friend could go from being the most perfect, wonderful person in the world to being a cruel, uncaring villain. It's a world of black and white, with almost no room for gray in between. So what's driving all of this? The absolute crucial thing to understand here is this deep, intense fear of abandonment. And we're not talking about a small worry. This is a frantic terror of being left alone. It creates this hypersensitivity where even a totally neutral comment might feel like a huge rejection, which can then trigger really intense anger or panic. So if that's what's happening on the outside, in relationships, what's going on inside? Well, that brings us to the emotional storm that's really at the heart of BPD.
Right, so how does a professional actually diagnose this? They use a guide called the DSM-5-TR, which lays out 9 key criteria. To get a diagnosis, a person needs to meet at least 5 of them. As you can see, it covers a huge range of experiences, from that intense fear of abandonment we just talked about, to things like having an unstable sense of self and impulsivity.
And the list also includes things like really intense and rapid mood swings, a chronic feeling of emptiness, explosive anger, and even feeling paranoid when under a lot of stress. So yeah, as you can probably tell, this is a really complex disorder that can look very different from person to person.
But if you had to nail down the single most characteristic symptom of BPD, this would be it. Affective instability, which is basically a term for rapid, intense mood swings, is reported in a staggering 95% of patients. And let's be clear, these aren't just bad moods. We're talking about huge emotional shifts that can happen multiple times in a single day.
Okay, so what happens when that internal emotional storm just gets to be too much to handle? Well, a lot of the time, it bursts out as impulsive and sometimes self-damaging behavior. This impulsivity usually shows up in at least 2 different areas of a person's life. And again, these aren't just bad decisions. They're often really desperate attempts to cope with overwhelming emotional pain. This can look like anything from reckless spending to substance abuse, or even suddenly ending a relationship that was once incredibly important.
And this leads us to a really important and often misunderstood point. When people with BPD engage in self-harm, it's often not because they want to die. It's better described as a compulsive act, a desperate attempt to find relief from an unbearable inner tension. It's almost a way to make that invisible internal pain feel real and manageable on the outside. All right, let's zoom out for a second. We've talked about the personal experience. Now let's look at some of the numbers. And honestly, some of this data might really surprise you and challenge some common assumptions.
So first up, just how common is this? Well, studies estimate that nearly 6% of the U.S. population will meet the criteria for BPD at some point in their lives. That is way more common than most people realize. It affects millions and millions of people.
Okay, what about the gender split? You've probably heard the stereotype that BPD is a woman's disorder, right? Well, check this out. Out in the general population, the rate is basically 1-to-1. It's even. The 3-to-1 ratio we often hear about, that only shows up in clinical settings, which strongly suggests that women are simply more likely to seek treatment for their symptoms than men are.
And this right here just shows you how complicated all of this gets. You see, BPD very rarely travels alone. A whopping 85% of people with BPD also have at least one other co-occurring disorder, like major depression, an anxiety disorder, or a substance use disorder.
Okay, now we're at what I think is the most important part of this whole conversation. And it's the part that just completely busts the biggest myths out there. Let's talk about the path to recovery.
You know, there's this really harmful myth that BPD is a life sentence, that it's untreatable, that people can't get better. This is just plain wrong. The long-term data tells a completely different and much more hopeful story.
I mean, just look at these numbers from major long-term studies. And just so we're clear, remission means a person no longer meets the diagnostic criteria for the disorder. After just 2 years, more than a third of patients are in remission. By 10 years, that number jumps to an incredible 91%. And after 16 years, nearly everyone, 99%, no longer meets the criteria. So you see, recovery isn't some rare exception. Over time, it's the norm.
So, where does that leave us? Knowing this, knowing that recovery is actually the most likely outcome, how does that change how we think about BPD? How can we, all of us, help shift that public conversation away from stigma and towards support, away from fear and towards real, tangible hope? That's the question I want to leave you with.